Hello and welcome to On Second Street. Today we're going to be talking about an interesting issue that has to do with being paid to give plasma. A lot of viewers will know that you can go and donate blood and you tend not to be paid for it, but there's some debate about whether or not people should be paid for donating plasma. Here to chat with me more about this is Peter Jaworski. He's a Canadian who's an associate teaching professor at Georgetown University in the United States, and Kate Vandermeer, who is a co-founder of a patients group called Plasma for All. Thank you both for joining me today. Peter, I'm wondering if you could just take it from the top and tell us about the picture. What is plasma? How is that different from blood? And sort of how does that whole system work?
Yeah, sure. Thanks for having me, Colin. So plasma is a part of our blood. It's the yellow part of our blood. It's what's left over when we remove the red and white blood cells and the platelets. Inside of that plasma are important proteins. And what we do is we collect plasma. We can use it for transfusion, so just like blood. But we can also take that plasma and turn it into these essential therapies like immunoglobulin or albumin or a variety of different clotting factors. We use those medicines for patients with rare diseases, sometimes for people who suffer from shocks or trauma or are fire victims. These are important medicines that we use. And as you might know, Canada does not collect enough plasma to make enough of those medicines for the patients in Canada that rely on them.
Okay, and I want to talk about that in a moment, but Kate, I'm wondering if you could just maybe tell us a little bit about your experience as a patient who depended on these being able to access plasma, and maybe just sort of what some patients go through when it comes to this matter.
Sure. So, again, thank you for having us, Colin. And I was diagnosed in 2019 with a rare disease called multifocal motor neuropathy. And that's just one of many rare diseases that can be treated with immunoglobulin. And there are two delivery methods. The first is intravenous immunoglobulin, where it is injected into your veins through an IV drip. And the other is called subcutaneous immunoglobulin, or SCIG for short. And that is a subcutaneous, so under the skin treatment, a slow infusion. So rather than going to the hospital once every 3 weeks for a large infusion, it's something you could do at home once a week, and it gives you a steadier dose. When you are on IVIG, you're getting your dosage all at once and you kind of fall, whereas on SCIG, you have a steady weekly dose. And my plan with my doctor, because I live in rural Ontario, so far away from the hospital, the plan was to switch from my loading dose of IVIG to SCIG within 2 months. And I was not able to do that because of the plasma shortage. There was a shortage of the subcutaneous immunoglobulin product. At that time, I was supposed to start SCIG in May, and I was unable to until October because of this shortage. And when that impacted me, I had to dig and find out what the reason was behind this. And so I untangled the web of plasma donation and where my medication was coming from. And eventually that led to meeting Peter and beginning Plasma for All.
And so, Kate, I know that you speak with patients who have other conditions that require regular transfusions of blood plasma. What are the potential consequences if people don't get access to blood plasma?
It's really an individual impact, and because there's such a wide range of diseases that plasma therapies are used to treat. So it could be as simple as anxiety and inconvenience over not having access to your medication. In my case, it's a case of disease progression, where if I didn't have access to plasma therapy, my disease could progress. And for other patients, such as people with primary immunodeficiency, it could be as serious as life and death. Their health is seriously at risk without those medications.
Okay, so it's obviously quite crucial for many people. When we come back, we're going to unpack this issue a bit more, talk about the supply, how much is being donated each year, where plasma is coming from, and also sort of some of the ethics and the questions around whether or not people should be able to donate paid plasma and then be compensated for it. We'll be back in just a moment.